How's it going, guys? Medium difficulty question, hematology, step 1, internal medicine, 2CK. Before we start, subscribe to my channel. Really appreciate it. Give it a like, really appreciate it. Find me on Instagram, Mehlmanmedical, and Mehlmanmedical. Links down below for me, Telegram. Links to Telegram group and channel down below. Now start the clip. 34-year-old woman. She has low hemoglobin, 10 grams per deciliter. Should be 12 to 17.5. Menstruating women, 13 to 17.5. Non-menstruating women and men. MCV low, 74. Should be 80 to 100. So we have a microcytic anemia here, for starters. And then you see that the iron and ferritin are normal. So we can summarize this as a microcytic anemia despite a normal iron and ferritin. And I'll talk about that as we move through the question, which the following most likely seen as patient. Let's just whip through. Choice A, acanthocytes, wrong fucking answer. You need to know that these are liver failure in USMLE, classically heat stroke. Okay, I've harped on this in many of my YouTube clips where resources tend to get the yieldness inverted, where you'll see these spur cells, these spike RBCs. Resources tend to say that these are A beta lipoproteinemia. Nonsense yieldness, okay? I think I've maybe seen it like once assessed on NBME content. They love acanthocytes for liver failure. Okay, they'll say 82-year-old woman found in her house in the summer, body temperature 105, and she's got acanthocytes on a blood smear, and the answer is just liver failure. That's heat stroke, okay? End organ damage to hyperthermia, usually over temperature 104. I've also seen these in a hepatitis C question, okay? So liver failure, and then you can also be aware of A beta lipoproteinemia. Wrong fucking answer. Choice B, high RDW, red cell distribution with, wrong fucking answer. So this is going to be iron deficiency anemia in USMLE, okay? So the distribution of our cells in terms of the size of the RBCs, all you need to know, okay? You're gonna get a big fucking question, have no idea what's going on. All you need to know is if they tell you RDW is not elevated, you can say, cool, not iron deficiency anemia. Okay, so a high RDW is sensitive for IDA, where if the RDW is normal or even slightly decreased, you just know it's not IDA. I have seen RDW in a variety of conditions on NBME exams. It's no one specific condition, but as I just fucking said, all you need to know for this is that a high RDW means IDA, and if it's not high, it's just not IDA. Wrong fucking answer. Choice C, high hemoglobin, alpha 2, delta 2, also known as hemoglobin HbA2, correct answer. Okay, so diagnosis here is thalassemia, which is going to be, we have a microcytic anemia despite a normal iron and ferritin. Now, what's going to happen is on USMLE, they can present thalassemia in a couple ways. You can't rely on target cells as a crutch. Okay, it's too easy. So there's a couple ways thalassemia is going to present. Number one, like this, you have a microcytic anemia despite a normal iron and ferritin. The second is you've got a patient who has a microcytic anemia that does not respond to iron supplementation. So they don't tell you the iron values. The patient's been on a vitamin. They like that for OBS-GYN in particular, where a woman comes in for her first antenatal screening. They say she has a slight microcytic anemia. The assumption is that it's just iron deficiency anemia from prior menses. It's very common. 99% of the time, microcytic anemia in a menstruating woman is going to be IDA. So you just say, well, take your vitamin, you're pregnant now, or just start eating spinach, start eating red meat, and then, or she's taking an iron supplement, and then a month later, she still has the microcytic anemia. Next best step is check serum iron and ferritin. You're going to see that they're normal. Then the next best step for 2CK is going to be a hemoglobin electrophoresis, where if you see increased HbA2 and HbF, then that is beta thalassemia minor. Beta thalassemia major is going to be a sick kid. Okay, they like giving you a beta thalassemia minor, and if it's a normal hemoglobin electrophoresis, that will be 1 or 2 alpha mutations. Okay, so it's a normal hemoglobin electrophoresis. If we have 3 or 4 mutations where you get a beta 4 tetramer HBH for 3, or hemoglobin Bart's gamma 4 tetramer, which is fatal in utero, those are kids. Okay, so a sick kid with 3 mutations or fatal in utero, a hydrops fatalis for 4 mutations. So they like the adults for this. Okay, so if you do the hemoglobin electrophoresis once again in this patient and it's normal, we say that's going to be alpha thalassemia, 1 or 2 mutations. If we have increased HbA2, which is alpha 2 delta 2, and HbF, that's going to be beta thalassemia minor. So let's just whip to the other answer choice here. Choice D, hollow jolly bodies, wrong fucking answer. These are seen in asplenia. So these are nuclear remnants. It can literally be surgical splenectomy, or it can be sickle cell. They like that, okay? And because sickle cell autosplenectomy, repeated microinfarcts to the spleen, and then you need to know that they're going to get vaccines against strep pneumo, Neisseria meningis, Haemophilus influenza type B, okay, the important encapsulated organisms. Algibides have also seen these for Ivermark syndrome and TCK, which is going to be dextrocardia plus asplenia, okay? And you just need to know that patients with asplenia, I mentioned the encapsulated organisms, but if you're forced to choose, strep pneumo is the most important, okay, in terms of causing sepsis in patients with asplenia. Wrong fucking answer. Choice C, schistocytes, wrong fucking answer. So schistocytes, lengthy discussion, okay? So these are the fragmented RBCs, can be seen in conditions such as hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, HELP syndrome, okay, in pregnancy, hemolysis, elevated liver enzymes, low platelet count, disseminated intravascular coagulation, prosthetic valves, mechanical hemolysis. Wrong fucking answer. You know the deal. To make more content if you like my stuff, subscribe my channel. Appreciate your time. That's it.